Assalamu alaikum. Pyare bachcho, I hope all of you are fine. Today the topic for discussion is, let's see what we have got. As you can see two celebrities. Any guesses? Yes, of course. There's a very famous world boxer, Muhammad Ali, and another actor. If you have seen the movie Back to the Future, well, it's a very old movie. आप लोगों की पैदाइश से भी पहले की है. Michael J. Fox. And here we go. We have got another picture. So, who is this? Yes, the very famous Chaudhry Shujat Hussain. And now you might have guessed that what I'm going to teach today, the topic of discussion is, yes, drugs for the treatment of Parkinsonism. You are right. Okay. So basically, what is happening in Parkinsonism? First of all, there is deficiency of dopamine. You all know, you have studied in physiology that there is imbalance between dopamine and acetylcholine, right? What is Parkinson's disease is also called paralysis agitans or shaking palsy, and it's a progressive neurological disorder of muscle movement, right? So if we see the signs and symptoms of Parkinsonism, what is it? Basically, there are tremors, muscular rigidity, which is cogwheel. There is bradykinesia, which is slowness in initiating and carrying out voluntary movements. And there are postural and gait abnormalities and mask-like facies. And usually it is occurring in the people over 65 years of age. That was an old theory, but now it occur at any age, right? Because there are many factors which are affecting the Parkinson's disease. Move on to the etiology. Etiology is basically deficiency of dopaminergic neurons in substantia nigra, and these are involved in the motor control. So as you can see in this diagram, what is happening, there are various factors which are responsible for Parkinson's, like one of them is aging, genetic predisposition, there is oxidative stress, and various toxins and defective energy metabolism factors. These are all affecting the contributing to Parkinson's disease. So, what is our basic teaching treatment strategy now? Since there is deficiency of dopamine, right, in the basal ganglia. So, what happens that there is imbalance between excitatory cholinergic neurons and diminished number of inhibitory dopaminergic neurons. So there is imbalance between acetylcholine and dopamine. So what is our aim of treatment? Common sense. Either we are going to increase the level of dopamine or we are going to decrease the level of acetylcholine. So basically now we move on to the classification of the drugs for the treatment of dopamine. We classify them as drugs affecting brain dopaminergic system and drugs affecting brain cholinergic system, right? So in dopaminergic system, we can classify them further as dopamine precursors, and one of them is levodopa, the main prototype drug, very important drug from examination point of view as well. Then we have peripheral dopa decarboxylase inhibitors, in which there is carbidopa. I will tell you what is the function of this enzyme in a diagram. And now we move on to other drugs are benzoyl and dopaminergic agonist. Levodopa was precursor and agonists are bromocriptine, pergolide, and pramipexole. So, and another classification, MAO-B inhibitors, in which there was selegiline and COMT inhibitors like entacapone, tolcapone. Now we move on to the drugs which affect the brain cholinergic system. In cholinergic system, there are centrally acting anticholinergics. So we have studied anticholinergics, antimuscarinic drugs in ANS. So can you name any drug? This was important at CQ and MCQ. Classify the anticholinergics according to therapeutic effects, right? So in central anticholinergics, we have the main drug trihexyphenidyl, benztropine, procyclidine, piperidine, and antihistamines as well. H1 blockers which have also anticholinergic effects like orphanadrine and promethazine. So this is basically till now we can say we know that Parkinsonism is caused because of deficiency of dopamine, and there is imbalance between dopamine and acetylcholine. So our treatment aim is strategy is to decrease the level of acetylcholine and increase the level of dopamine. So we are giving drugs which are affecting both dopaminergic system as well as cholinergic system, right? And I've told you the most important drug which is involving in this Parkinson's disease used for the treatment is levodopa, and it's very important from examination point of view as well. So if you see levodopa, okay, its basic mechanism is that it does not cross the blood-brain barrier. It's the dopamine. It does not cross the blood-brain barrier itself, right? And our aim is to increase the level of dopamine in the brain. See, but its immediate precursor levodopa is actively transported into CNS. Okay, as let me move on to the next slide so that you can see more clearly. Yes, this is the diagram from your Lippincott, and as you can see, okay, there is a dopaminergic neuron, right? And in the A is the fate of administered levodopa. As you can see, there is a very fat, thick arrow which shows that administered levodopa is metabolized in the GID, and less amount of metabolism of the levodopa is occurring in the peripheral tissue, which leads to its undesirable side effects. And dopa is then entering into the dopaminergic neuron, and then dopa gets converted into dopamine, and we need dopamine, and the dopamine acts on its receptor, as you can see postsynaptically. Okay, now as we classified the drugs used for increasing the level of dopamine, we said कि dopamine precursor, in which there was levodopa. As you can see, 90% of the drug is metabolized in the periphery. Only 10% of the levodopa is reaching the um, dopaminergic neuron. So, how can we increase the level of dopamine? We can increase the level if we administer carbidopa along with levodopa. Why? What is carbidopa? Basically, there is the metabolism of levodopa which is occurring through dopa decarboxylase enzyme. So if we give carbidopa with levodopa, the function of carbidopa is that it inhibits the enzyme dopa carboxylase. So what will happen? There would be inhibition of metabolism of levodopa in the periphery, और ज़्यादा levodopa जो है वो available होगी to enter as dopa in the CNS. ठीक है, so this is the important HCQ. Mind it, it's a very important HCQ. What is the rationale for the use of carbidopa with levodopa in Parkinsonism? ठीक है, so you can draw it with a flow chart as well, right? And similarly, you can write it in points or bullets. And this is another question when you ask in Journal Pharma, okay, what is can you name three methods by which the bioavailability of a drug can be improved, right? So one of them was if you increase the dose, if you change the route of the drug, right? Route में अगर oral दे रहे थे तो you can transform into parenteral. And the third method by which you can increase the bioavailability was that if you give an enzyme inhibitor. So dopa decarboxylase is the enzyme which is causing the metabolism of levodopa. So if you give carbidopa, which is an enzyme inhibitor, more of the drug would be reaching the CNS, and there would be minimum peripheral metabolism. So I guess this is the part 1 for Parkinson's disease, and we will continue our lecture in the part B. Thank you very much.